Action News is committed to taking action for you. And through our new Patient No More series, we're digging into health insurance denials.
Yeah, for the past 2 weeks now, we've brought you the voices of patients who had health insurance companies denied treatment that their doctors actually prescribed.
All of us have been denied life-saving measures. So just make it make sense.
That's more than the mortgage on my home. Where would that money come from?
I think people need to speak up and make things happen.
But there are tactics you can use to fight a denial.
I-Team reporter Kylie McGivern is showing the power you have as a patient.
More than 2 out of 5 working age adults report being charged for a health service that they thought was free or covered by insurance. And fewer than half challenged those bills by contacting their provider or insurer. But it's important to know you can fight back, and you have a good shot at winning. We spoke with Sarah Collins with the Commonwealth Fund in New York, a nonpartisan nonprofit which did that study on health insurance denials. Tell us what you all found with that.
It sheds light on a very troubling reality that many people with insurance are facing coverage denials that are for care that's recommended by a doctor. And many people are just simply at a loss about what to do about it. And what was quite surprising is that about half didn't challenge, said they didn't think they had the right to do it. So I think that is really a troubling finding. People absolutely have the right to challenge their denials. They have the right to challenge denials even after a denial has been upheld by an insurance company. You can still go back and challenge it and appeal that decision again. A lot of people also said they really didn't know who to contact. But I think there is a lot of confusion clearly about people's understanding of their rights.
Some tips: if you do get a denial, contact your insurance provider and ask about the steps to appeal the decision. Then contact your healthcare provider to make them aware and ask for any advice and supporting documentation. Also ask them to write a letter about the medical necessity of the denied treatment. And if you're a Medicare recipient and suspect fraud, waste, or abuse, the hotline is 1-800-MEDICARE. Another question we've gotten is, at what point do I contact an attorney, and is it worth it? We brought that question to attorney Thomas LaGreca with Callagy Law, based in New Jersey.
Most of our representation is the medical community against the insurance industry. A lawyer, unless he takes it on in some sort of pro bono capacity, is going to be charging that patient for billable time. It may be $400 an hour, and it may be $2,500 that the poor patient, who's already not getting the care they need, needs to fork over to a lawyer to send some sort of demand letter to a carrier, and that may not even work. It just adds insult to injury to the patient community.
LaGreca tells us he sees 3 big problems.
The patient is caught in the middle of the payment dispute between the medical provider and the carrier, and the patient doesn't belong in the middle of the dispute. There's all sorts of challenges that the medical community faces, and therefore the patient community faces, when it comes to having the carrier community behave appropriately.
Online now, we've included more information so you can fight back against health insurance denials. I'm Kylie McGivern, taking action for you.